Thank you for joining us for the third annual Global Summit, Global Kidney Innovations, Expanding Patient Choices and Outcomes, a collaborative partnership event presented by the American Association of Kidney Patients and the George Washington University School of Medicine and Health Sciences. My name is David Rodriguez. I am an AAKP Board of Director, Executive Committee member, and an AAKP Ambassador for the state of Texas. I am also a kidney transplant recipient for almost 10 years, with 3 years on hemodialysis, and a patient advocate for 13 years. My journey as a patient has reminded me the importance of access to kidney care innovations and the principle of patient's care choice as a health consumer. Patients play a critical role, both here in the USA and globally, in creating the demand for innovation and more choices because patient lives are in the balance. Our highest expectations is to reinforce the need for patient consumers to raise their voices in the process and create the demand for new diagnostics, devices, and biologics in their independent countries, and have a united patient consortium that can support the demand globally and support patients in countries where healthcare systems and/or infrastructure may not support patient consumer choice and access to care treatments. Being a part of AAKP allows me to be the voice for my community and the state of Texas, and around the country through my personal experience, and promote chronic kidney disease awareness around the globe. Today, I am pleased to introduce a longtime friend and an ally of AAKP, Reginald Seeto, President and CEO of CareDx Incorporated, for our session on emerged research with global implication, advancement in cell-free DNA testing to improve post-transplant care. Ladies and gentlemen, Mr. Seeto.
Hi, my name is Reg Seeto. I'm the President and CEO of CareDx. I'm really proud to be here today presenting and talking at the third event between AAKP and GW. I'm really excited because I was present during the inaugural event, and we just think it's a fantastic initiative that's been undertaken. Firstly, I'd like to thank the leadership team at AAKP. It's been a really tremendous partnership working together with Richard, Paul, and Ed, and what you do every day in and out means a lot to us and for the patients all across the world who are watching today. CareDx has been around for more than 20 years, and our mission has been simple, and our vision is really to be the leading partner for the transplant ecosystem. In terms of our mission, it's really about how do we improve organ outcomes, and it's something that's driven by innovation, and that's what more than 500 employees across the globe focus on day in, day out. How do we serve you, the transplant community, and the transplant patient? And this is part of the management team. As we looked over the last 12 months, it's been a difficult period around the world, and everyone's been impacted by COVID. But just know, front and center to what we do day in, day out has been about how do we support the transplant ecosystem, the transplant patients, and the transplant community. We thank all the carers and providers who have been looking after the patients during this very difficult time. And so, just to highlight some of the key parts of CareDx, I mean, in the last few years, we really have become involved with the transplant company. And today, if we look at the kidney space, more than 1 in 4 patients are involved with CareDx and with our marker, which you'll hear about later on, called AllyCare. And the reason we've been around is because we've been known for innovation. And so we were the first to bring gene expression profiling in transplant. We were the first to bring donor-derived cell-free DNA in transplant, and that's what you'll hear a bit about today as well. And we're the first, actually, and only company to bring multimodality approval, that is combining technologies to bring incremental clinical utility. This is so important for us as a company that drives innovation, to bring things that mean a difference to clinicians and to patients, and ultimately, how can we do better to serve you? And that's really important for us. As a result of that, I can share that on the heart side, more than 90% of centers are involved in using our offerings, and more than 75% of kidney transplant centers today use AllyCare. We're really proud to be serving patients, and again, to be such a core part of each transplant center. And so really this highlights and showcases what we do on the patient journey. We have a focus not just on one part of what patients go through, but in all parts. And this is what we call the patient journey, looking at pre-transplant, peri-transplant, and post-transplant. And on the pre-transplant side, we actually are actively involved in the waitlist management area through a group called XinCare, which has been part of CareDx over the last 2 years. We also have the latest type of HLA typing, the only type of NGS or next generation sequencing called hybrid capture. This means that the tests don't have to repeat in the HLA type because it's the most sensitive test in terms of being no repeats. And so we're really proud to bring this innovation on the typing side as well. If we move in actually on the post-transplant side, we have AllyCare, which is a marker looking at cell injury, and it's really transformed what has been done in the transplant community on the kidney side. More than 150 centers of the 200 in the United States actively use AllyCare, and we're really proud to be the company that's brought this, particularly with our transplant focus. What you'll see here is some of the other offerings we're bringing, and what we found is by having more than one offering, we can actually increase the clinical utility in how we assess a transplant patient's organ status. And I think what we have here is iBox, which is a prognostic algorithm, which is derived and come from the latest and leading center institution in Paris. We also have AllyMap, which is gene expression profiling, which is built off the many years of experience we've had with AllyMap on the kidney, on the heart side. And then we have several other different types of tests. And UroMap is an example of a urine test that we're also developing, which came out of Cornell. The important thing is, as we look at this patient journey, we also have a very strong relationship with the centers, which we just talked about, these 150 plus centers. And what we've tried to do also is improve the workflow. So as anyone who's worked in a hospital setting or a patient, operational workflow, EMR records are so important. And so what we have here is a direct connection through 90 plus centers through AllyCare. And recently this year, we also acquired a company called TransChart. And so now we're more than 90 plus transplant centers with an EMR focus. And we also help centers with what we call quality management. And we have a company called XynCopy that helps out there as well. And some of you may have seen this. So really for us, it's following that patient journey and being involved at every critical juncture for you, the patient, and also with the hospital setting ecosystem. And so if we think of the kidney patient who's at end stage renal disease, there are really only sort of two options. You continue on dialysis, or you look at kidney transplant. And I think without a doubt, the kidney transplant option is one where provides a much improved quality of life, and at the same time, it also has a much longer survival period, up to 10 years now. So we're really seeing a real shift in the whole transplant community of how do we increase the number of available organs, how do we get more patients on transplant. It's actually the basis of a major initiative which was announced about 2 years ago, and something which we see continued progress. It just shows how important it is to look at transplantation in kidney patients. And so we have this opportunity to get a transplant, which is great news, but at the same time, 1 in 5 transplants do fail. And so that's not good, right? These are such precious organs, and it takes such immense time to get these, and there's such a long wait list. So us as a company, how do we try to improve that survival outcome? How do we ensure that any form of injury or potential rejection is picked up earlier? So that was one of our deliberate missions as a company. How can we help out in this space? And so if we look at our technology, it measures donor-derived cell-free DNA, and essentially this is looking at cells that are released during the course of injury or death, and it's not something that should be elevated in most patients. What we have is AllyCare is the first analytically and clinically validated donor-derived cell-free DNA test, and really we brought this into the space. And it's hard being a trailblazer, because when you bring new technology, when you bring new innovation in a space which hasn't had a lot of new innovation or new technologies, it truly means that you have to shape the space. And we're really proud that there's been such a rapid and early adoption at more than 150 centers believing and using AllyCare. And I think more than 60 of these centers actually have a protocol which is AllyCare specific. So in many cases, it's really, really hard to get protocols, and this broad adoption. It's because of our ability now to say, is something happening when you have this elevation? Because it tells the clinician that there should be a high level of scrutiny and also monitoring this patient, because you shouldn't be having an elevation of donor-derived cell-free DNA, because it's a marker of cell injury. And so if we look at AllyCare from a clinical perspective, there are centers that look at how do you do biopsies in a surveillance perspective. That's fewer and fewer in the United States now. And then you look at what are some of the non-invasive forms. And so historically, there's been serum creatinine. There's also been DSA looking at different forms of injury or potential rejection. What we found through multi-center prospective studies, we're the only company that's done that, again, multi-center prospective studies, is that what AllySure has been able to demonstrate is a more accurate test and also an earlier predictor than what we've seen with serum creatinine, and also with the prediction of de novo DSAs, which is a precursor of DSA. So this has really been a pivotal moment for the field, as we now have the ability to do a non-invasive test, but also provide unique insights much earlier and more accurately. And so if we think of that from a clinician's perspective, myself being a physician, what does this mean as we monitor patients? What does this mean with these precious organs that we've been provided, and the fact that 1 in 5 still fail after 5 years, and that really isn't acceptable. And I think it's something that what can we do more of? And so with AllySure and as a biomarker, what you can see here is that if it is elevated, there's a form of injury. It could be indication of rejection, but what's important here is that it allows that point of intervention by the clinician. And so there's either adjustments in medication, there's more intensive monitoring of the patient, and there's further workup. But what you see then is once that patient and that graph starts improving, then you can see a decline also in the AllySure measurements. And so it's a tool that is used in terms of surveillance to allow the ability to detect if there's a change in the status of the organ, and that's really important. It's such a precious gift, and my aunt's on her waiting for a third, and I think everyone at CareDx has such a special sort of association in the transplant space. I recently hired someone who is based out of Florida, and her daughter is a young kidney transplant recipient, and so for us, we really live this in our mission. And so I think that's why AllySure continues to be such a powerful new form of innovation for the space. And the important thing is, we're a company that is driven by bringing good science and innovation, and so we're the only company that does multi-center and has done multi-center prospective studies. And that's really important, because you don't want to just do a test in one center. You want to do multiple centers as you develop this technology. On top of that, you want to look at things prospectively. That is, you measure these in patients as doing an actual study, and not trying to look retrospectively after at patients. And I think that's really, really important. What we found is we're really good at generating good innovation, but we're even better at generating good science. And what you can see here is we've got the most number of publications on this space in terms of transplant donor-derived cell-free DNA. And more importantly, AllySure is the test that has set all the reference standards. So we talk about different protocols. We talk about monitoring. There's things such as what we call relative change value, which tells, should you be even more concerned because the test has changed above a certain threshold between measurements. We created that standard working with transplant centers across the United States. We continue to bring these reference standards, which is so important, multiple publications which indicate, how do we have early detection of de novo DSA as a precursor for DSA. And, when you get ambiguous rejections, how can you tell if they're clinically relevant or not? So the importance here is that as a company is that we believe in innovation, and we've been the first at every stage. But more importantly, we continue to drive that innovation and generate insights both for the centers, the patients, and the physicians. And it's so important for us. And so this slide I want to share because I actually showed it 3 years ago at the inaugural meeting. And also it reflects a board discussion we had, which is we're being asked, should we go into other areas or should we stay in transplant? And, my response at that time and now as CEO is that, we're 100% transplant focused. And really, when we were challenged upon that, what difference will you make as a company, right? And we said, what we want to do is improve that organ survival. And then how do you do it? Like, is it something that's theoretical, or is it something that's really real? And so for us, we said, if we know that there isn't always this standardization among treatments. And so that was really important for us to, as we led to AllySure, to have this sort of protocol and surveillance to understand how do we get standardizations across different institutions. The other one is compliance and adherence. Without a doubt, one of the major risk factors for not having organ survive is if there isn't good medication adherence. And so this compliance and adherence has been something that we've developed tools and actually been actively monitoring through services such as AllyCare and our patient care managers. And then we talk about immunomodulation, either being overexpressed or undersuppressed, can often lead to adverse sequelae. So for us, it's really important to actually make some investments in developing studies in this area. The point being is, if you have a strategy which is really to help patients and improve organ outcomes, then you really have to have a process and approach to do it and truly deliver on it and do it on good science. And that's really important for us as a company. And so we've heard about AlloSure, but AlloSure was something we brought more than 3 years ago, and we have moved on from there because the new innovation, and we're the only company in the United States that's had multimodality approval in transplant, and we showed that on the heart side at the end of last year, and now we're doing it on the kidney side because we want to continue to bring innovation for kidney transplant patients. And so what this does is combine technologies to increase the clinical utility for physicians, and so there's a more accurate test, and you get additional insights as part of that. And we demonstrate that on the heart side, and what we're now doing on the kidney side is similar, which is combining different technologies. Here we have the AlloSure, which is a donor-derived cell-free DNA, as well as AlloMap, which is a gene expression profiling test, which looks at the immune status of the patient, and then iBox, which is a prognostic algorithm. Now, what we've added since then, which you hear about more in the future, is three additional tests. One is called UrinMap, which is urine test, which I mentioned earlier, which is also looking at acute cellular rejection, but also a tissue test called HistoMap, which is the latest form of innovation which has come in the space. And then also we have a infectious disease test called AlloID. So what we want to do is bring multiple offerings across multiple modalities to bring incremental value, incremental clinical utility for the physician, so that ultimately the patient will benefit, and ultimately so we can change the fact that 1 in 5 kidney transplant organs will fail within 5 years. That's our mission goal, to see how we can help. And so as we look at the patient engagement, and obviously we have so many patients across the globe that have dialed in today, we believe that you also have a role. And we have developed what we call our direct-to-patient approach, because we feel that we've brought great technologies, we have great relationships with the centers, but we want to develop that relationship with the patients even further. And so what we have here is just one example of some of the offerings we're bringing. This is called the AllyCare app, and it's something where you can do a couple of things. It allows medication adherence, and we talked about how do we improve that adherence. This is a way of ensuring compliance. The second area that this can help out is looking at different biometrics, which you can capture on a daily basis as part of this. And thirdly is including scheduling as you look at AlloSure. The important thing is we continue to add things to this app, and this can be used not only in post-transplant patients, but also in pre-transplant patients and across different organs. And I think as we've moved in this digital world post-COVID or during COVID, I think the more chances and interactions we have on a digital basis is so important for us. So we continue to work with patient groups to bring offerings. And just so you know, AllyCare app was designed and developed not by us, but by transplant patients, transplant centers, transplant physicians giving their input, and we put it together. So we're really proud to bring the AllyCare app, and this is something that just has an incredible uptake since it was rolled out at the end of last year. And so one of the other offerings we have is RemoTrack, and this was something that during the peak of COVID last year in March at the onset, we had outreach from multiple centers and patients. CareDx, how can you help us during this time of COVID? Because we have to go into get our blood drawn or get our test, whether it's in a lab or whether it's in an out external phlebotomy, whether we multiple patients there, or it may be a chance where we now can no longer get our biopsies in some patient settings. And so there was an outreach of how can we help. And so within a matter of a week, we as a company were able to put together this offering called RemoTrack on a national basis of where we could help out this community and say, we will give you a remote offering, the safety of your house. And so blood draws could be done there. The important thing about this is a service that was asked for by patients for safety, asked for by the centers, and we as a company, without a thought for cost, without a thought of how to roll this out, said, well, how do we find a solution? How do we find a solution? That's what we do at CareDx. I mean, if it's patient, we're patient focused and we're patient centric, and I think that's why conferences and meetings such as this are so critical to continue that patient story. It's so you all have an incredible voice, and that's one that I think you should continue to use. Of how can companies do more to partner with you? Because our goal is to be that leading partner. And so as we sort of conclude this presentation. I want to again thank AAKP. I want to thank GWU for this opportunity. It's the third meeting. I'm so happy to see this progress. But one thing you should know about us is we continue to embrace working with the transplant patient community, and we during this time of remote offerings, we've continued with patient education, and I think we've delivered over more than 20 different presentations and webinars during the course of the pandemic, and thousands of patients have benefited from these. And for us, once again, CareDx has been around for more than 20 years. We're going to be around for the next 20. Our mission is patient driven. So thank you again for the time to talk about CareDx today. I'm extremely proud to be the CEO of this company because of what we do and because of the fantastic people we get to engage with. Thank you again.
Mr. Seeto, we have several questions to ask you. How do you tell the difference between patient DNA and kidney DNA?
AllyCare uses single nucleotide polymorphisms, or commonly known as SNPs, to distinguish between the donor and the recipient. The SNP is a variation, that is a change among individuals at a single position in a DNA sequence. AllyCare looks at a panel of carefully selected SNPs and uses then an algorithm which is able to discriminate between donor and recipient DNA. And the important thing to note is, as we look at these SNPs, we look at changes across every single somatic chromosome. We're the only company that looks at these changes across all, and that's why it's so important to have this type of technology, but one that's being developed from a transplant basis.
Our next question, what happens if I'm high risk for active rejection with AllyCare?
If you have an elevated AllyCare, it's not normal. There is something that's happening which could indicate a form of injury or could be a form of rejection. What typically happens is the physician will then do additional workup to exclude whether it's infection, to do additional blood tests to exclude whether it could be a form of rejection. But this is really a way of telling you something is not right in what's happening, and that this measurement or this detection of this donor-derived cell-free DNA and this elevation tells you that something is actually happening. So this warrants and requires investigation.
And Mr. Seeto, one final question. What is the difference between AllyCare and my routine labs?
AllyCare really is the latest form of innovation and technology which allows you to actually detect forms of injury in the kidney much earlier and also more accurately. So if we compare that, for example, to creatinine, which is often a later test, and injuries actually happen to the organ already. So for us, it's really important if we want to improve the ability of detection of injury to a kidney transplant, then we need to be able to detect that injury earlier. And so that's why AllyCare is such a powerful diagnostic tool.
We appreciate Mr. Seeto for taking the time to share his insights and expertise. Thank you.